Good morning, and welcome to this virtual event on migration and health in the Americas, being co-hosted by the Pan American Health Organization and the International Organization for Migration. This morning, we have brought together stakeholders in health and migration in the Americas, countries, international organizations and NGOs, civil society groups, the press, and of course, the leaders of the Pan American Health Organization and the International Organization for Migration. This event will focus on the health context of migration in the Americas, and we will witness the signing of an agreement between PAHO and the IOM that will strengthen collaboration between the organizations. But before we begin, let's discuss some logistics for our virtual event. We are running the event in Zoom, and we have available interpretation services in Spanish and in English. For those services, please go to the icon for interpretation, select language, and mute original language. Please do keep your mics closed during the event if you're not speaking. We will have a question and answer sessions later, so please use the chat during the session for any questions that you may wish to present to the speakers. The event is also being transmitted on our social media platforms, Facebook and Twitter, and being live streamed on YouTube. And of course, we encourage you to engage with us on social media. The IOM is represented here this morning by its Director General, Antonio Vitorino, and senior staff, including Luca Dalloglio, the Chief of Mission of the IOM in Washington, D.C., Marcelo Pisani, the Regional Director, South America, Ms. Michelle Klein-Solomon, the Regional Director for Central North America and the Caribbean, and Diego Beltran, the Special Envoy for the Venezuela response. PAHO is represented by our Director, Carissa Tien, and with her today is the Deputy Director, Mary Lou Valdez, the Assistant Director, Jarbas Barbosa, Ciro Ugarte, the Director of Public Health Emergencies, and myself, James Fitzgerald, Director of Health Systems and Services. To begin then, I would like to invite Dr. Carissa Tien, Director of the Pan American Health Organization, to address the forum.
Thank you, James. Senor Antonio Vitorino, Director General of IOM, and senior staff in IOM, Dr. Mrs. Lou Valdez, Mary Lou Valdez, our Deputy Director in PAHO, Dr. Jarbas Barbosa, our Assistant Director in PAHO, other UN colleagues, NGOs, civil society. Let me also greet James Fitzgerald, who is moderating, but is our Director of Health Systems and Services, and Ciro Ugarte, who is the PAHO Health Emergencies Director. And between the two of them, they lead the work in PAHO on migrants. Let me also greet all of you who are joining us this morning on the various social media platforms. A very good morning to all of you. Let me begin this morning by congratulating our sister organization, the World Food Program, for having been awarded the Nobel Peace Prize. I hope it is public. If not, I'm sorry to spill the secrets, but certainly congratulations. And we at all in the UN system, all of us are so pleased, and we feel part of the movement, and we really congratulate you. As director of the Pan American Health Organization, I am pleased to be co-hosting this event with my colleague within the United Nations system, Antonio Vitorino, who, as you know, is the Director General of the International Organization for Migration. As the respective heads of our agencies, we have committed to sign today a memorandum of understanding that will deepen our collective action in the Americas to support and improve the health and well-being of migrant populations and that of their host countries. The region of the Americas has a long and rich history of migration. Extracontinental migration continues with regions such as Asia and Europe. Active migration exists between clusters of countries and economic blocs, such as the Caribbean community, and from these clusters as well. It is estimated that over 6.3 million Caribbeans live outside the Caribbean region. Migration continues also between our northern and southern continents. Indeed, most countries in the region have been at some point in time territories of origin, transit, destination, and return. As we recognize the history and the tradition of migration throughout the Americas and its contribution to the diversity, wealth, and development throughout the region, we must also recognize that throughout the mobility continuum, migrants are often exposed to diverse social, environmental, and economic factors that jeopardize their physical and mental health and well-being. Migrants face challenges at every stage of the migratory process. Transitioning through countries, their health security is often threatened. They often face stigma and discrimination as they seek the most basic care and treatment, food or shelter. And they face important cultural barriers which impact access to health. In recipient countries, administrative barriers impede access and coverage in essential services, with safety nets often excluding the migrant population from accessing social services and protection mechanisms. I dare say that this situation has been further exacerbated by the COVID-19 pandemic, where as of today, there have been more than 17.5 million cases and more than 580,000 deaths. And that is throughout the Americas. And with the economic downturn that we are witnessing in many of our countries, migrant populations are among the first and hardest hit, with both a direct and an indirect impact on their health and well-being. Migrants often lack adequate sanitation and living conditions, which has made physical distancing extremely difficult, if not impossible. Certainly for those living in informal settlements, in shelters, and immigration detention centers. Migrants are one of our most vulnerable populations, and in terms of equity and social justice, migrant health is a priority. And health and migration constitutes a critical area of work that all social and developmental sectors in the region must address. In 2018, PAHO convened a ministerial conference on health and migration, where ministers of health throughout the region called on regional action to address the complex reality of health and migration in the Americas. This reality is characterized by an increased demand for health services in border areas across the Americas, with local health systems struggling to meet that demand. It's also characterized by an inadequate mechanism to meet both the short and longer term health needs of migrants, together with the host population, as a consequence of limited financial, human, and infrastructure investments in health systems. And also policy and legislative frameworks that inadequately protect migrants, limiting their participation in national health, social, and economic development. PAHO has been engaged with countries and the IOM in addressing these challenges. We have supported national intersectoral policies and plans that ensure that health action within the context of migration remains a priority. At this stage, I want to highlight and thank all of the other NGOs, civil society groups, and UN agencies who themselves have contributed to the health and well-being of the migrants in the Americas. PAHO has supported with IOM and other partners national intersectoral policies and plans that ensure that health action within the context of migration remains a priority. We have worked collectively and with civil society to organize and support the strengthening of border health, in the expansion of border healthcare networks, and in health reciprocity agreements between countries. We have supported legislative action that guides countries in supporting the integration of migrants within social and healthcare systems. We have trained healthcare workers to better address the differentiated needs of the migrant population. And we have worked with countries in building the systems that support migrant needs in the country of return. In our COVID-19 response, we have worked closely with countries and partners in surging national capacity, including the prevention and management of COVID-19 in migrant shelters and centers, and the organization of triage centers for suspected COVID-19 cases. The work completed has shown us that there is so much left to be done. And through this agreement we are signing today with the IOM, we believe that we can bring to bear the respective expertise and convening power of our agencies in health and migration in support of our member states, migrants, and the host population. But you may well ask, what does that mean in terms of the program of work that we have envisaged moving forward? I believe it means intensifying our support to countries in the development of transformative policies that are based on the principles of universal access to health and universal health coverage. And that includes and addresses the migrants' needs. It means strengthening the response in border health to ensure human security and social protection, while ensuring emergency health preparedness and services. It requires strengthening the organization of border health services network based on the primary healthcare approach with culturally sensitive, gender responsive services that are adapted to both the needs of the local and the migrant population. It means improving healthcare surveillance, monitoring the health status of migrant populations, including the identification of risk factors to address migrants' specific health needs, especially for those most vulnerable within the migrant communities, for example, the women and children. It also means working together to enhance intersectoral collaboration, to better plan health interventions with a short, medium-term, and long-term vision within the overall holistic development that our migrants must be part of. The region of the Americas has participated actively in the negotiation and the adoption of numerous global and regional agreements in health and migration. This memorandum of understanding we are signing here today with the OIM will support the translation of these high-level agreements into an operational support framework for implementation of these agreements at the national and the local levels. It will broaden and facilitate inter-country development, implementation, and oversight of national policies in health and migration. Yes, we are very, very ambitious. I would like, Antonio, I would like to thank you and the IOM for your work in the Americas, for supporting the health of migrant and host populations, and promoting and protecting the principles of the right to health for all in this region. I am looking forward to deepening our relationship and building on the joint PAHO IOM platform to advance health as a driver for development in the region, addressing the needs of this vulnerable population during these times of a pandemic, but beyond. The 2030 Agenda for Sustainable Development has identified action in migration as key to a more sustainable and equitable world. And the SDGs have identified the achievement of universal health as a foundation for health and development, SDG 3. Through our strengthened partnership, I am confident that we are taking one more small but important step in the Americas to make sure that by 2030, we have achieved our goals that have been set forth in the Sustainable Development Agenda, making sure that we are truly leaving no one behind. Thank you for this opportunity to work with you, Antonio, and the rest of your staff. Thank you.
Thank you very much, Dr. Etienne. I'm now pleased to invite Mr. Antonio Vitorino, the Director General of the International Organization for Migration, to address the forum.
Thank you so much, and good morning to all of you from Geneva. Dear Director, dear Carissa, dear colleagues of PAHO and IOM, ladies and gentlemen, let me start by joining you, Carissa, in congratulating our colleagues of the World Food Programme for the Nobel Peace Prize 2020. It's a tribute to the remarkable work of WFP, but also a tribute to multilateralism in the current times. We in IOM, we welcome with great appreciation this meeting with PAHO, which paves the way to joint efforts and also to exploring new innovative partnerships. We are committed from our side to ensure a rights-based, people-centered, and inclusive approach that prioritize the safety, dignity, and well-being of assisted populations. Multilateralism is invaluable in the pursuit of inclusive and sustainable development as outlined in the Agenda 2030. And as you have said, Carissa, truly leaving no one behind means guaranteeing the full respect to universal health coverage. As the United Nations have shown with the adoption of the Global Compact on Safe, Orderly and Regular Migration and the Global Compact on Refugees, we stick committed to these values and these principles as a system and as individual agencies. As you mentioned, migration to Northern America is a key feature in the Latin America and in the Caribbean region. Social economic conditions and generalized community-level violence in several Central American countries have contributed to migration, including, one must say, high numbers of women and children who are particularly vulnerable to trafficking and abuse and exploitation. In these conditions, migrant smuggling has become a major feature of the sub-region as people attempt to bypass border controls in Central America and Mexico. And during the COVID-19 pandemic, irregular migration flows and smuggling has intensified, exposing migrants to severe health risks. Just last week, 4,000 migrants from Honduras, including unaccompanied children, arrived in Guatemala without proper health checks and in vulnerable conditions. Furthermore, as we all know, the sub-region of the Caribbean is highly prone to both seismic activity and climate-related disaster risks, exposed to sea level rise, and recent disasters have shown the large scale of displacement of populations and loss of lives, unfortunately. Intra-regional migration within South America continues to be very significant, with the large majority of international migrants currently moving within the sub-region. Moreover, political and economic turmoil in the Bolivian Republic of Venezuela has led to one of the most acute humanitarian crises in the world, displacing millions of people from the country. Since 2015, more than 5 million migrants and refugees have left Venezuela, making it the largest recorded displacement crisis in Latin America. In response to this situation, IOM and PAHO have built a particularly strong strategic partnership in the framework of the Regional Interagency Platform for Migrants and Refugees from Venezuela. As you know, the platform is co-led by UNHCR and IOM. PAHO co-leads the health sector of the platform, and we have been collaborating very closely with hundreds of NGOs, private sector, and entities of the civil society of the host countries during the past years to support Venezuelan migrants and refugees, including by addressing their medical needs. But COVID-19 has exacerbated the already challenging situations in which displaced Venezuelans have found themselves in, while highlighting the important structural inequalities and obstacles they face already under normal circumstances. Though localized to particular countries in Latin America, one should not forget those who are displaced inside their own countries. And one must recall that over 5.7 million people remained internally displaced in Colombia at the end of 2018. Poverty, despair, and lack of employment opportunities continue to trigger perilous migration flows and, of course, associated health risks. Many migrants in an irregular situation lack access to health services, and many suffer deplorable living and working conditions, especially being prone to mental health problems. Many countries and agencies of the UN system are promoting the health of migrants. However, we are witnessing a trend towards fueling social exclusion of vulnerable migrant groups and leaving their health needs unattended. This is particularly serious when it comes to women, pregnant women, girls, and children in general. The current pandemic is once again teaching us that the lack of appropriate health insurance, often coupled with insufficient financial resources, may negatively impact in migrants' ability to take preventive measures against COVID-19 and to receive medical care if contaminated. Their living conditions, so often in urban slums or in camps of refugees or migrant workers, make social distance almost impossible, and therefore the migrants and refugees are more prone to vulnerable to the disease, to the spreading of the virus, but also to stigma and hostilization, because they might be seen by the communities as virus carriers, provoking a negative reaction. This initiative today is very simple. We sign a paper. But the question is legitimate. What does this mean, signing an MOU of agreement between the two organizations? It means two fundamental things. First, it's an MOU based on the concrete work that we have already developed in the ground, in the field, with the beneficiaries to the protection and safeguarding of their human rights and their health. But it also means a commitment for the future, a commitment of sharing values and being engaged to guarantee full access to health care for migrants, refugees, displaced people, in general terms, people on the move. This initiative will bring together, I hope, governments, other UN agencies, civil society, implementing partners, and the academy across the region of Latin America and the Caribbean, and across sectors and disciplines to address migrant health issues associated with rapidly changing and increasingly diverse societies. We will act as one UN and will definitely, Carissa, as you said, leave no one behind. Thank you.
Thank you very much, Mr. Vitorino. So now we come to the part of the agenda where PAHO and IOM will sign the Memorandum of Understanding between the two organizations. To moderate this portion of the agenda, I will hand over to Luca Dall'Oglio, the Chief of Mission of the IOM here in Washington, D.C. Luca?
Thank you, James, and Director General, Mr. Vitorino, Director Dr. Etienne, distinguished guests, ladies and gentlemen. It's a pleasure to be with you and with the IOM and PAHO colleagues in the region. We have now reached the peak of today's high-level event, the signing of a landmark agreement between the International Organization for Migration and the Pan-American Health Organization in order to strengthen our partnership on health and migration in the Americas. This agreement builds on the ongoing collaboration already taking place in the region and led by PAHO's leadership, along with the IOM colleagues, the regional directors, who for IOM will be tasked to translate this MOU into action. And I know that they are participating in this event and would like to recognize them. Michelle Solomon for Central America, North America, and the Caribbean, Marcelo Pisani for South America, Diego Beltran, the Special Envoy for the regional response to the Venezuelan situations and outflows. The commitment of our respective agencies will help facilitate collaboration in the area of migration health in order to address the health needs of migrants and host communities and to assist member states in addressing health issues associated with the different stages of the migration cycle. The signatory representing PAHO today is Director Carissa Etienne, and representing IOM is Director General Antonio Vitorino. Prior to this event, the signatories exchanged signed copies of the Memorandum of Understanding for each party to countersign during today's ceremony. At this point, I kindly request the cameras to be positioned only on our two principals for the virtual signing. At this time, I'd like to invite both parties to sign the agreement between IOM and PAHO.
Are we blocked?
She's like this, no?
Yeah.
Are we? Where are we? Are we back online?
I see you, Luca, but the other pictures are still frozen.
I don't know what happened. I think I saw that I disappeared from the screen early on in just saying these few words, and I don't know what happened with the arrangements. This is
Luca, if we wait just 1 minute, we will see if we can get Dr. Etienne's camera online for the signing.
yes. Where have you got lost? Do you know exactly? At the beginning, I assume.
No, we heard you until the moment you said that we were about to sign. We were going to sign. And that was the moment where we lost connection.
Just to let you know that we are still connected. This is Ciro Ugarte, Director of Health Emergencies, but the video is not active, so the host will
Sí,
deactivate. Okay?
sí. ¿Qué pasa?
Okay, Monica, you are live. Director General, if I may, in the meantime, and to keep the flow of the meeting, maybe we can explore a little bit more with you some of the important issues that you were referring to within the context of COVID-19, while we see if we can bring back Dr. Etienne live. From your perspective, how have you really seen, what impact have you seen in terms of the migrant population and within the broader context of health and migration? What impact have you seen COVID-19 having within the broader context of migration? I know you mentioned it a little bit in your opening remarks, but perhaps you could expand on this for us while we bring Dr. Etienne back online.
Yes, with pleasure. Well, just very briefly to say that a little bit everywhere we have seen, of course, migrants losing their jobs and employment because the vast majority of them work in the informal economy. And due to the lockdowns and the closure of the borders, in order to respond to the pandemic, they were the most vulnerable to losing their livelihoods. We are pleased to see, for instance, that in a number of countries, like in Colombia, evictions have been stopped. But of course, losing the shelter they had was one of the most striking impacts of the pandemic. A second movement I would emphasize is the mobility of some Venezuelan displaced people who have returned to Venezuela, putting even more pressure and stress on the Venezuela health system that is already under enormous constraints and difficulties. And the third, last but not least, of course, reaching out to migrants and making them access to health care is quite challenging because sometimes they are in locations that are not very easy to access. So in these three elements, at least, I would say that the pandemic has had a relevant impact in the situation of migrants. And therefore, for instance, in some cases, the dangers that people are taking, the risks that people are taking are very high. I've mentioned the caravan of Honduras to Guatemala last week, 4,000 people displaced without any kind of health control, and therefore risking not only their own lives, but also the potentiality of spreading the virus.
Okay, thank you very much, Mr. Vitorino. I understand we have Dr. Etienne back. Dr. Etienne, do you hear us?
Yes.
Very good. Okay, so Luca, I will pass over now to you, back to the signing ceremony.
Thank you, James, and apologies for these inconveniences associated with our, virtual way of working. But let's go back to where we were, and we have now reached the peak of our event and ceremony today, and this is the signing of a landmark agreement between IOM and PAHO in order to strengthen our mutual partnership and collaboration on health and migration in the Americas. This agreement builds on the ongoing collaboration already taking place between our organizations in the region and is led by PAHO's leadership along with IOM regional directors, whom I would like to recognize as participating today from Central America, Michel Solomon, Marcelo Pisani for South America, and Diego Beltran, the special envoy for the regional response for the Venezuela outflows. The commitment of our respective agencies will help facilitate collaboration in the area of migration health in order to address the health needs of migrants and host communities and to assist member states in addressing health issues associated with the different stages of the migration cycle. The signatory representing PAHO today is the Director Carissa Etienne, and representing IOM is Director General Antonio Vitorino. Prior to this event, the signatories exchanged signed copies of the Memorandum of Understanding for each party to countersign during today's ceremony. At this point, I kindly request the cameras to be positioned only on our two principals for the virtual signing.
Congratulations.
Thank you.
So now with this,
Thank you so much.
Thank you. Thank you. And thank you very much, Luca, for moderating that part of the agenda. We'll now move to some questions, and I would invite the participants in the meeting to post your questions in the chat. We have some questions in the chat already. We've also received some questions prior to the event following the issue of the media advisory. And one question I think that I would like to start off with is for Dr. Etienne. A question on what are the real specific main health challenges that migrants are facing in the Americas at present? If you could elaborate a little bit more on that for us.
So thank you very much, James, for that question, whoever posed it. And when I joined back the chat, I was listening to Antonio, who has addressed many of the main challenges. So I'm not going to repeat those that he said, but to complement and supplement. Migrants normally along the mobility continuum, they continuously struggle to access health services, sanitation, social protection mechanisms, and they face discrimination and stigma. And certainly during these times of COVID, it is heightened. And COVID, it has been an experience that has exacerbated many of the deficiencies that people face and also highlighted the plight of the most vulnerable populations. Besides their lack of access, they tend to have very little access to water and sanitation. And so the very basic principles of how you protect yourself from COVID, many of them don't have access to. They don't have access to hand washing facilities. We say that they must avoid clustering. They must do greater spacing. Many of them don't have those, that possibility. They live in crowded situations, both in a home, but also in the centers that they must occupy. I would like to reiterate the exclusion from health promotion, disease prevention, treatment and care, which leaves them without sufficient information as well, and information that's culturally sensitive as well, to help them to take preventive measures. I think also that they have diverse health needs. They have specific risks. Many of those based on sexual and gender, with violence being an important part of this. And they almost seem to be left behind, and their specific needs not necessarily frontally addressed within this COVID-19 pandemic. I think the closure of borders has caused really a pressing situation for hundreds of stranded individuals. And in some cases, they are unable to meet their most basic needs, as Antonio was pointing out, for food, for accommodation, for healthcare, among others. We are also concerned about their mental and psychosocial health. Migrants are usually under significant mental health stress that can be exacerbated during this period, but they can de novo face unusual psychological reactions which worsen existing mental health conditions or vulnerabilities. And this is a particularly important issue, as it affects the most vulnerable within them: women and children, adolescents. And much of the violence, the gender-based violence that we are seeing, is stemming from this excess psychological and mental health stress on others within the household. So I think what we are seeing is a vicious cycle, whereby although migrant populations are at greater vulnerability, they have less ability to ensure preventive measures against COVID-19 and safety against COVID-19. And as well, they do not have, or have very little access to social protection in terms of food, in terms of water, sanitation, labor, jobs, etc. And also, importantly, little access to preventive, promotive, and curative health services. Very often they are afraid to seek care, and so even if they are showing signs of COVID-19, they don't go forward for a test because of this stigma and discrimination, because they are afraid to suffer other negative consequences. And so, of course, they are a vulnerable group for COVID-19 because of this lack of access to everything. Then we see that COVID-19 can spread within these migrant populations. And for PAHO, within COVID-19, the migrant population is a vulnerable population on top of the vulnerability that they had experienced before. Over, thank you.
Thank you. Thank you, Dr. Etienne. I'm building on that, Mr. Vitorino. We often, when we consider migrant populations, populations that are along the mobility continuum, either moving through countries, across borders, there are over 70 million persons who have crossed international borders in 2019. That's IOM data. For those migrants that are already in their destination countries, from the perspective of the IOM, what are some of the more systemic issues that migrants face that could eventually impact their health and well-being?
Well, the first challenge is to guarantee that the migrants that Carissa has mentioned that are stranded do really get to the countries of origin. In our assessment, worldwide, there are 2,750,000 migrants that are stranded at the current moment in the borders due to the travel restrictions, due to the closure of the borders, due to the lockdowns in a number of countries. what we have been witnessing is that when they manage to get to the countries of origin, they are confronted with some risks of stigmatization too, because not all countries of origin are prepared to welcome them, to quarantine them in safe and dignified ways, and also to guarantee that they are reintegrated in the communities of origin. We have a few examples all over the world where people who have come back from the diaspora to the country of origin have been hostilized upon arrival by their own friends and family in the communities of origin, because they were seen with suspicion as carrying the virus with them. And those countries of origin are already under enormous economic stress because of the pandemic, because of the stop of the international trade, because of the lockdowns. So those countries that are vulnerable from the economic point of view suddenly see the arrival of a number of people who have no jobs and who have come back to the country of origin to benefit from some protection, from some family protection that might be at stake. Yesterday, just to give you a very concrete example, yesterday I was speaking with a journalist that is following a Venezuelan family that has been in Colombia, went back to Venezuela, and then not finding a solution in Venezuela, went back again to Colombia. So, as you can imagine, in this travel back and forth, they are very much exposed to vulnerabilities, to health risks, and definitely it's a situation of high instability.
Thank you very much. We have a couple of questions coming in from participants. Dr. Etienne, there is a specific question coming in from Lemina Ochoa, a reporter from UNO TV in Mexico, asking if PAHO considers that the Mexican authorities have provided or taken sufficient actions to ensure the health and sanitation needs to mitigate against the coronavirus for migrants to the northern and southern borders. And there's another question that's similar to that in terms of the capacity in Mexico to respond. So perhaps you could talk a little bit about the response, the PAHO response within the context of supporting Mexico.
So thank you, James. And I think from the outset, we must recognize the significant challenge to the authorities in Mexico to manage their own populations and the migrant population who face, as we said, some really very challenging situations. So PAHO, we have maintained close contact and coordination with the national health authorities in Mexico to support
Dr. Etienne? I think we have lost Dr. Etienne. We'll just give her a couple of more seconds. And if not Ciro, I will ask perhaps if you can
support the actions that they are leading in preventing further.
You are muted now, Dr. Etienne.
We, in addition, through the participation in the Situation Room, we have supported the preparation and review of technical guidelines that are associated with the COVID-19 response. Specifically on the actions to support the migrant population, we have close coordination with IOM and UNHCR, which includes efforts to mobilize resources and to strengthen the technical cooperation in two border areas, in the northern border and in the southern border. We have supported the Ministry of Health in the development of guidelines for the organization of voluntary isolation centers for suspected or confirmed cases of COVID-19. And the development of information, activities, and materials for the prevention, early detection, and the management of COVID-19 in shelters and for migrants and asylum seekers alongside UNHCR, IOM, UNICEF, and the International Red Cross. Moreover, PAHO has carried out advocacy activities aimed at promoting the implementation of health protocols for the prevention and early treatment of COVID-19 at the reception points for forcibly repatriated, providing specialized services for children and adolescents, and decongesting shelters by supporting the relocation of migrants and asylum seekers in community establishments intended for the isolation and care of suspected confirmed cases of COVID-19. And we've done that both in the northern and southern borders in close collaboration with the health jurisdictions, both at the local level and at the national level. It continues to remain a challenging situation in both northern and southern borders, and we are grateful to be part of a broad coalition that is working together to address the issues of migrants at the northern and southern border in Mexico.
Thank you very much, Dr. Etienne. Following that, Mr. Vittorino, what lessons do you think the region can take on board, perhaps from other regions globally, in terms of border health, the expansion of health services and the provision of emergency services within the context of borders? Have there been experiences outside of the region that perhaps countries can benefit from as they try and address this very important issue?
Well, I would say that the first and most important lesson worldwide for developing countries, but also for developed countries, is the top priority of investing in the health systems. Because the response to the pandemic has taken us all by surprise. And I would say that now there are no excuses for not seeing the absolute need to have a heavy engagement and commitment of the member states, of the countries, in investing in their health systems in order to be capable to respond to such a devastating pandemic. If you want, there are two test cases approaching. One will be vaccination. When we get to have a vaccine, and hopefully we will get a vaccine, it is absolutely necessary to guarantee equal and fair access to the vaccine to all countries in the world, to all groups of the population in the world. It's a gigantic task, undoubtedly, but we need to guarantee that nobody is excluded from benefiting from the vaccine once the vaccine is made available to the population of the world. The second test is that it's quite clear that the world cannot go on being locked, borders cannot be closed, and definitely crossing borders, restating mobility, relaunching mobility will require, in crossing borders, a very heavy health assessment about the situation of those who cross the borders. Together with PAHO, we are in quite a large number of points of entry all over the world. And it is quite clear that in those points of entry, we need to have the necessary infrastructures, but also the civil servants, border guards or migration officers with the necessary skills to make health proofing in order to allow the crossing of the borders. This is a total change of culture, and it will require investment in infrastructures that not all countries can do, and it also requires training of the border guards and the migration officers in health issues. But we cannot afford having a two-tier or even a three-tier mobility system in the world. We cannot leave any country out of the mobility system. And this will have to be a joint task of all countries working together, cooperating, and being supported by the multilateral system with organizations like PAHO and IOM. Thank you.
Thank you very much. And I think a final question is coming in from one of the participants on the role of civil society, specifically within the context, but the specific question was in the context of Venezuela, but more broadly, the role of civil society partners in supporting the implementation of this memorandum of understanding between PAHO and IOM. So I'll start first with you, Mr. Vitorino. What do you see the role of civil society and NGOs in supporting the overall work program in this area?
Well, it is a crucial role. I can be very brief. It's a crucial role. I've given you the example that in the support of Venezuelans in the Latin American region, in the platform that we have together with UNHCR, with the PAHO, with UNICEF, with WFP, we have more than 94, almost 100 entities who are implementing the commitments of the platform and deploying the necessary support to the migrants. So the blood that runs in the veins of the platform is not a bureaucratic blood. It's a lively blood protagonized by the NGOs, by the private sector, by the civil society as a whole, and we very much rely on them to succeed in making guaranteeing the access of migrants to healthcare. Thank you.
And for you, Dr. Etienne, the same question?
Thank you, James. And frankly, in many of the borders within migrant populations, the civil society movements, they form the core of action in migrant populations, particularly at the border. Remember, many of those borders are sometimes very rural, on the periphery, where for the national situation that their systems have not yet penetrated well into these remote localities. And so the presence of civil society is crucial, and let me use the same word that Antonio used, is extremely important. They actually know the needs of the migrant population, because very often they live in that situation. They open offices in that situation, and they're in contact with migrants. They provide direct care and access for social and environmental determinants of health, mental and psychological support. They sometimes are the interface with migrants and local and national authorities, a very, very, very important interface, and they represent the needs and the rights of those migrants. And they are also very vocal. I think this is very, very important. They are really strong advocates for the plight of the migrant population, and particularly at the borders. They say things that we as UN agencies cannot say, and that we rely on people to say. They stand up for the migrant population, who very often do not have a voice and cannot have a say. And so I do feel that, that they are integral to any action on improving the health and well-being and for the development of a migrant population. And they are a partner of PAHO, and I'm sure of the IOM in this. Thank you very much.
Thank you very much. And that, with those words, we have come to the end of this event. I really would like to thank the Director General of the IOM, Mr. Vitorino and Dr. Etienne from PAHO for sharing their vision of in the future health and migration in the Americas, and also the respective IOM and PAHO teams for working collectively to make this a reality. So thank you very much and a very good afternoon to you all. Bye-bye.
Thank you. Bye-bye.
Thank you, Torino.
Thank you, Carissa.